Welcome to the Hormone Optimizing Warrior MD, your reliable and trusted source for information on hormone therapy for menopause and beyond, and on how to advance into the second half of your life with confidence and optimism, knowing your hormones are optimized and balanced with everything else in your body. Whether it is hormone therapy, peptide therapy, laser therapy, or some other new technology applicable to maintaining our vitality, mental and physical strength, you will hear all about it in this podcast. Thank you for coming back to listen to another episode of the Hormone Optimizing Warrior MD podcast. In the last week's episode, I did talk a little bit in detail about the nationwide shortage for estradiol patches, which is impacting many women and which is unfortunately most likely here to stay and wax in and out of having the patch available or not. Women have to resort to a lot of solutions and alternative ways of obtaining the patch, like trying a 90-day prescription from a mail order pharmacy or trying another brand of patch, even though they're not always pleased that their brands of patches are switched from month to month sometimes. Most pharmacies are starting to release only 30 days at a time. Some pharmacies are happy to release 90 days at a time. When the patient finds it, she's happy. At least she doesn't have to worry for 90 days that she's not going to have the patch. So it's becoming a little bit stressful, right? Women are also combining patch doses. Like if their normal dose is 0.075, then they do 2 patches of 0.0375 if those are available. But again, that might not be covered by insurance. You might need to pay out of pocket, and that's inconvenient at some point, right? So I plan to deliver a series of episodes that's focused on what are the most viable FDA-approved synthetic and mass-produced alternative, whether they're equal or not. The patches, they're not quite equal. They're different in bioavailability. They're different in cost. They're different in how they're applied. But let's review all of them. And there's so much to say about each one of them. And I feel that women are not getting the full picture from a lot of physicians around the country. And not a lot of physicians who prescribe are comfortable prescribing, or they know the intricacies of all the details around prescribing a variety of FDA-approved products. So today's episode is going to start talking about something you probably haven't heard of and you're probably not very familiar with, because these kind of options are likely to be much more readily available because everybody's literally favoring patches, and I talked about why in the previous episodes. And also, women are going to go to the next option on their plan B, which is going to be estradiol gel. So in today's episode, I want to talk about using the vaginal ring, which you probably have not heard of, and many physicians have not heard of it. But if you are on the patch right now and you're using it to help your symptoms and make your quality of life better, you should be very interested in this episode. Because, like I said, you should have some kind of preparation for plan B, which is what I call when your pharmacy runs out and you cannot find it at any other pharmacy. And if that's the case, your life might become very difficult, unbearable if it's not available, and you get your symptoms back. So please activate your plan B, and hopefully you know exactly what your plan B will be after you listen to this series of podcast episodes around other options outside the patch. And interestingly enough, I've known about them. I recommend all of them, and I give women a large variety of choices to pick from when they come to an appointment with me, which is not what's happening at a regular doctor's appointment. There's a lot of options available, and sometimes I don't really have the time to cover all these options in one visit. So this is also created as a tool for my patients to go and listen to the podcast episodes before they come to the visit, so they know, hey, I listened to what you said, and of all the options available, I really would like this. So this is a little bit selfish, but it's also meant and intended with the purpose to educate women, not just my patients, but everybody who listens to this podcast, about alternative options, because this is, like I said, a very hot topic right now. And surprisingly, there's a lot of them. So let's talk about option number 1, which is the vaginal ring. There are 2 products available on the market right now, and it's important that you do not confuse them. Femring is the product approved not just for local vaginal and urinary issues, but also for mild to moderate hot flashes relief. That means it does have systemic effects, or what we might call body-wide consequences. This is true hormone therapy for menopause. So remember, it's called Femring. Because you might be thinking, wait a minute, it's a vaginal ring, so it's only for the vagina? No, it's not. The second ring, it's called Estring. It's very similar in name and presentation, so you might confuse the two. That's why I wanted you to know about these 2, right? Now, Estring only releases estradiol locally and in low doses. It's enough to provide relief for vaginal and urinary issues. Very similar to topical vaginal estrogen, which is estrogen applied directly to the vagina. I will talk about these vaginal options at the end of this series, probably when I talk about oral estrogen. But once I finish with the FDA therapies approved for menopause therapy, then I will focus on the GSM approved, genitourinary syndrome of menopause approved, FDA approved therapy options. So coming back to Femring, and the easiest way to remember this, it's the one that starts with F is for female body, your entire body. The one that starts with E is just estradiol, just topical, local estradiol. I don't know if that's going to help you remember or differentiate between the 2, but I figured I should suggest it. Now, Femring is a silicone-based ring able to release estradiol at a reasonable, steady rate for, wait for it, 90 days. Very similar to a pellet insertion, but it does unfortunately cost a pretty penny if not covered by your insurance. And as opposed to the pellet, it does not release any testosterone, only estradiol. Now, this is a very soft, pretty flexible, opaque, whitish silicone ring that measures about 2.2 inches in diameter. It contains estradiol acetate. Why estradiol acetate instead of the bioidentical estradiol? Because it is much more stable, can be incorporated in the silicone ring, and it's also allowing for the longer shelf life, which is required if it's going to be mass produced. This is an ester form of estradiol. So having this estradiol acetate, this facilitates the absorption through the tissues. Even though we know that estradiol apparently absorbs easily and without any difficulty from whatever product carries it when you place it in the vagina, this is easier to release it into the tissues from the ring. So once it's absorbed into the body, the estradiol acetate will be converted into bioidentical estradiol by enzymes which are present most likely within the vaginal tissues or wherever this esterified form of estradiol will travel within the body. Just the same concept as injecting men with testosterone cypionate. All the testosterone injections are not bioidentical, and the testosterone cypionate or enanthanate, it's actually converted to testosterone once in the male body. So very similar, right? Now, the bioavailability for this product is superior to the patch, and that's critical to know and remember. It provides a constant, steady release of estradiol. So this specific option could be very popular. Hey, it's the same as the pellet. I put it in for 90 days. It's going to get a lot of release, steady rate. So why not choose it? Well, it's not very popular with women for quite a few reasons. I'm going to get into them in a minute because it seems ideal. You just place it and forget it for 90 days. You just take your daily progesterone at night. Very convenient. But when confronted with this option, many women say no. So I'm going to go over the disadvantages of the estradiol ring, because if you think about all these disadvantages and you realize, well, you know what? It's better to use this if I can get it covered rather than just going without anything, then maybe you will come around. So number one, This device has to be self-inserted and left in for 3 months at a time. While many women have zero issues with pellet insertions, they just come in, they get an injection, they walk away, they're happy. Many women have an issue with inserting a vaginal product that's supposed to stay in place 3 months. It literally freaks them out. There are women who have never used tampons. They're not comfortable placing something vaginally and leaving it in there for 3 months at a time. If that's you, then this is not a product for you. But keep listening, because it's probably going to be better than nothing when you are going to have to choose between patch or no patch. The ring is very convenient. For someone using the ring, if the ring is completely controlling your symptoms, she just needs to go to the pharmacy 4 times a year. You get a 1-year prescription from your doctor. So this is most likely the case for established patients who are established ring users. And after the first year of treatment, just come in once a year, all is well, you get your prescription, everything is good. Now, I have had lots of patients who actually loved the ring. Now, they had some issues, which I'm going to tell you in a little bit, but in the long run, it's a very valid, useful option to consider and to have on your plan B. Here's the next downside. There are only 2 doses available for the vaginal ring, for the Femring. There's not a lot of flexibility there. So if your symptoms are not controlled on the highest dose available, you're just simply out of luck and you will have to switch methods. Or consider continuing the ring and adding something else that controls your symptoms. That becomes complicated, and at that point in time, you might as well just switch. The lowest dose will release 0.05 milligrams daily and contains 12.4 milligrams of estradiol acetate. That is the recommended starting dose. The next dose releases 0.1 milligram estradiol daily and contains 24.8 milligrams of estradiol acetate. You can find these doses online very easily. You do not have to remember them. Just remember the lowest dose releases 0.05. The highest dose releases double that, 0.1 milligram. Now, as the ring is prescribed for 90 days, if your first prescription is for the lowest dose and you do not have good symptom control, I suggest immediately, within 30 days, you're going to know if it works or not. Make an appointment with your doctor and discuss adding another additional estradiol therapy at the discretion of your physician, depending on their knowledge, on the cost, and whatever you choose. And at the next prescription, you can use the higher dose. And then if you've got excellent symptom control, you found your solution, you can stick with it. Otherwise, you can't just get the ring out and put a higher dose once it's prescribed, because this is a 90-day steady release device. Your insurance is likely not going to cover an additional device. So you're fresh out of pocket, and I'm going to get to the cost in a few minutes. But let me continue with another possible disadvantage, vaginal symptoms. This is number 3. The vaginal ring can create some significant vaginal symptoms in some women, not in everybody. It could cause vaginal discharge, possible vaginal irritation. Now, here's the thing. Nobody wants an itchy vagina. Apparently, the ring can increase the risk of vaginal yeast infections. So if, as a young woman or in perimenopause, you suffered with a lot of vaginal yeast infections and you have microbiome disturbances, that's probably not for you. You can try it. And if you have no issues, continue using it. But with time, the disturbance in the microbiome might actually be more and more persistent, depending on how long you use the ring, right? Now, depending on a woman's anatomy and how the ring is inserted and positioned, the ring might actually, if not inserted properly, it might cause compression on the bladder, on the urethra, creating the possibility of urinary symptoms, like recurrent urinary tract infections, urinary frequency, urgency. If you have urinary symptoms, come to the office, have the placement of the ring evaluated by your clinician. Ideally, at this point, it would be your gynecologist, not your primary care, because they don't really know the anatomy, so they might not be giving you good advice. You want to know whether or not the insertion is done appropriately to your anatomy and according to the instructions of the manufacturer, who recommends placing the ring all the way up at the end of the vaginal canal, literally as far up as you can get it. Now, this also means that not everybody might be a candidate for the ring. especially if their vaginal canal has been impacted by the severe vaginal atrophy caused by the hormone deficiency of menopause. And even worse, the possible subsequent significantly narrowing of the vaginal canal due to the lack of intimacy and shrinking to the point where the presence of the ring will create irritation on the tissues, right? So basically, if you've been in menopause for 10 years or more, this is not the best method that you want to start with, okay? If you're in early menopause, maybe even perimenopause, this might be an excellent method. Your tissues are already estrogenized. You're probably not going to suffer any of these problems. But if you are 5-10 years post-menopause, you've never used any estrogen, your tissues will probably need to be primed with some topical vaginal estrogen, either the insert, the cream. I'll talk about those in a future episode, because the ring would just not be a good idea for you. Now, even if it comes in 2 available doses, the ring only comes in one size. It's pretty soft and flexible, but the quality of the tissue that the ring will sit up against and someone's vaginal and urinary specific anatomy and very specific microbiome and vaginal health chronic issues might predispose to irritation, discomfort, discharge, or urinary problems. So if you have a sensitive vagina, this might not be for you. Number 4, this is a very big disadvantage, probably a limiting disadvantage, and this is cost. This is extremely expensive if you're just going to buy retail. It costs over $1,000, somewhere in the range of $1,100. That means it will cost you $4,000 a year. You're going to be like, okay, doc, you're crazy. You're probably going to stop the podcast right now and move on. No. It is generally covered by Medicare. However, it is placed on a higher brand name tier, which means you might be a little bit of out-of-pocket cost, and your cost will be highly dependent on your deductible and your coinsurance. So because there is no generic for Femring, it is a brand-only product. So that's why it's so expensive. Now, it might not be covered by your insurance plan, and if you need to pay the full amount, you're probably going to pay more than what you would pay for the patch. As it turns out, most PPO plans cover the Femring, but place it in a much higher cost tier and classify it as a non-formulary medication. They want you to use the cheaper stuff. That means if you want it, the doctor approves it, prescribes it, you might be charged the highest out-of-pocket copay or the highest current coinsurance that you have on your plan. Now, maybe more, your PPO might actually require your doctor to submit a prior authorization before agreeing to cover it, even if they cover it at a much higher cost, which generally, from what I've heard from quite a few of my patients that are coming and using this product, it's around $300 per ring. Now, here's the thing. The drug manufacturer, and I hope you stayed till now and listened, the drug manufacturer offers a copay card, which can lower the price to as little as $25. All you have to do is go to their website, femring.com, FEMRING.com. You access the savings program, which they have clearly listed up at the top. The $25 coupon only applies to your first prescription, your first ring. The subsequent refills are $190. Where does it say that? Well, I had to read the fine print. So go all the way to the bottom on the left side, and it will say there in very, very fine print that it's $190 for the subsequent refills. A lot more expensive than the patch, actually double the cost of the cash price for the patch. Also read the fine print at the bottom because there are many exclusions. Like Medicare, TRICARE, Medicaid, or Medi-Cal are actually not included in this specific program. This only applies to patients with commercial insurance whose insurance plan denies coverage. Now, Medicare patients have a different program. You have to go to the top, click on the specific tab, which says Medicare patients. You have to apply. It's like a program you enroll in. I could not find the price for that specific program, but I'm sure if you submit the form, they're going to get back to you with the cost. It's probably similar to what PPO patients pay. Now, at this price point, considering the value added of testosterone in your pellets, if you're one of those people that prefers a 90-day approach and doesn't want to mess with their vagina, you might want to consider pellet therapy. It not only includes testosterone, but it's also more customizable and probably much more effective, considering that it comes in a large availability of doses compared to the limited dosing that's available for the ring formulation. So, to recap, the ring is available. I had a pharmaceutical rep visit me the other day and drop off a little demo silicone ring so I can show it to my patients. Considering what we're going through with the nationwide patch shortage and the estradiol gel becoming a shortage pretty soon because women are running out of patches, running out of estradiol gel. It's surprising how many women are actually opting into the pellet therapy since I offer all possible options due to the nationwide shortage. So please consider the vaginal ring on your plan B. The plan B is the patch is gone. You can't find it anywhere. What do? You do not need to suffer. There are options available. And if you don't have any problems with vaginal wellness, if you are within 2 to 5 years from menopause, if your vaginal health is in pretty good shape, or if it just needs a little priming for like maybe 2 to 4 weeks with some estradiol locally, and if you don't have a problem inserting anything vaginally, this could be a great option. I hope this was useful, and I'm going to continue with your Plan B options next week when I'm going to talk about the estradiol gel. Thank you for the time and energy you spent listening to my podcast. If this episode or another have caught your attention and delivered valuable information you have not heard anywhere else, and if you feel I have succeeded in my mission to provide the how to stay healthy and age beautifully, please leave me a review. And any suggestion to improve the podcast will help make it better for you and for others. You can send my staff a message directly by sending an email to receptionist@herahealthcare.info.